Okay, we're back to our longer format answers now. Looking at this new district, new lines here. It is a sprawling district, and you would be representing these urban areas, Roseville, Rockland, Folsom, and a lot of very rural communities throughout the Sierra. And healthcare is one of the issues where the needs are so different if you're rural or if you're urban, and that's just one of many examples. So how would you represent everyone in this really big district? And Assemblyman Kiley, we'll start with you.
Well, I grew up in this district. It's where I was born and raised. I went to local schools, and I've had the great privilege for the last several years of representing well over the majority of it in the California State Assembly. And the area that I represent now does have rural and suburban components to it as well. It's an amazing district. It has many of the most amazing parts of our state in it, and I am tremendously excited and would be honored to have the chance to represent it. When it comes to healthcare, yes, there are unique needs for different types of communities. I will tell you that in California, we have a Medi-Cal system that is absolutely failing. We have over a third of the state on it, and yet there's no evidence of improved healthcare outcomes. And when it comes to inflation, this is affecting healthcare as well. We're getting word now that there's going to be a huge spike in Obamacare premiums, perhaps by the end of the year, which is going to raise rates by well over 50, premiums in some cases by well over 50%.
Sheriff Jones, how would you represent the diverse needs of this district?
Well, as pointed out, this is 10 counties, mostly rural. In this district, there are 12 hospitals, excluding Kaiser's, ranging in size from 17 beds to over 300 beds. Most of these hospitals serve rural communities, and they're always in danger of closing from financial reasons. The problem is that most of their patients are on Medi-Cal or subsidized exchange program policies. And compounding that problem is most of them come into emergency rooms rather than going to outpatient or other clinics. And the absence of telemedicine or effective telemedicine in these areas also play a part. What we need to do is create more jobs and job opportunities to elevate folks out of the Medi-Cal and exchange-based insurance programs and make sure they get employer-based private health insurance. It's better for the patient, it is better for the economy, and it's certainly better for continued access and availability of hospitals in these rural areas in this district.
Dr. Jones?
Yeah, 50% of this district is urban or suburban, 50% of this district is rural. And as was previously mentioned, we have serious issues with respect to people getting access to care. We have critical care hospitals that are on the verge of being in the red. We released the most comprehensive health care plan of anyone who's ever run for Congress, and that's because for the last 5 years, I've been taking care of people in this district in Northern California, seeing a lot of their issues. People that didn't have access to broadband weren't able to get telemedicine like they needed. That's why the infrastructure bill was good at bringing billions of dollars into our district for that. One of the things that we focus on in our health care plan is cost. As was mentioned earlier, cost is a huge part of inflation. We have some people who unfortunately can't afford their medications. We have a physician and healthcare provider shortage. When you look at the average number of providers in the country, we are lower than the average throughout our entire district. Our plan focuses on increasing the number of providers, lowering costs for patients, and focusing on getting care where they most want it in their homes.
So you brought up broadband. That is such a huge issue for these rural districts to have high quality, high speed broadband access. How would you get that out to a lot of these rural communities?
Yeah, my thought process has been that, all government spending isn't bad. Spending that actually improves people's lives, gives them the types of services that they expect from their elected officials is what we need. People are tired of career politicians. They want people with real practical life experience that know what it's like to be on the ground and actually move things forward, not people that have decided that they want to put self before service. We're going to focus on implementing a lot of those infrastructure dollars to get that last mile of broadband to every single person in our district.